Hey guys, and welcome back to my channel. In this video, I'm going to be talking about why ER wait times are so long. If you're new here, my name's Dr. Tank. I'm a practicing emergency medicine physician, and let's get right into it. So the first reason why wait times are so long is because of how many patients are actually showing up to the emergency room. Now I know this is due to a variety of reasons. It's getting harder and harder to see your primary care provider, see a specialist that you were referred to, or it's just after hours and the clinics are closed. But granted, the high volume of people makes it hard to see everybody in a timely manner. Going along with this, it's important to understand that we see patients first based on how sick they are. And I know this can be very frustrating and kind of a subjective thing, but we use objective data such as your vital signs and why you're here to determine when you will be seen. For example, if you are having a heart attack, a stroke, or having a major trauma, time is very important. And so we will likely see you first and you will likely bump the line. And going along with this, we do some triage testing such as EKGs to decide if your chest pain is something like a heart attack or not at that given time. The second reason why ER wait times are so long is because of limitation in resources. ERs tend to be staffed based on the average number of patients they see per year. And this can change, of course, year to year, but unfortunately, most ERs are short on doctors, nurses, and technicians. And so you can see how this can be a problem seeing everybody in a timely manner. The sad reality is ERs are kind of treated like a business nowadays, and they like to cut spending wherever they can. And so sometimes they will hire less staff. However, if a lot of patients check in at the same time, this can of course lead to longer wait times than normal. Third reason ER wait times are so long is actually due to administrative bottlenecks. So what I mean by this is after you're seen in the ER and we order some blood work and sometimes a scan for you, there's a lot of bottlenecks that can occur after this. Number one, after your labs are drawn and sent up, maybe the tube is down and the blood never reaches the lab. Next, maybe the blood reaches the lab, but the machine is down and has to be repaired. Third, maybe you go for a CT scan. However, the PACS system is down and the technician cannot send your images to the radiologist. Finally, if the radiologist is very busy, they might take a long time to read your scan, which would mean extra time for you to wait. All in all, these are all potential bottlenecks that can increase your wait time in the ER. The fourth reason ER wait times might be long is because of something called boarding. So after you're seen in the ER, it's possible you might be admitted to the hospital. If this is the case, we will have to request a bed for you, and sometimes the bed is just not available. So what happens next is the patient actually ends up sitting in the ER, usually in the same room that they started in, until they can go upstairs. Now this takes a bed away from all the patients out in the waiting room and can definitely add more time to everybody else in the department. So you might be thinking there's so many issues here, what are we doing to try to speed things up? Well, some ERs are implementing providers in triage, which can be either a physician or a mid-level provider that sees a patient as soon as they check in. And sometimes labs are ordered and imaging is ordered while they are waiting still in the waiting room. This is helpful because then when the patient gets back in the main ER, the physician can review all the test results and decide what to do next. We're also working on trying to explain to patients what conditions are appropriate to go to the ER and what conditions are appropriate to go to the urgent care. This is actually a big thing I want to talk about on this channel, as a lot of patients just don't know if the symptom that they are having is potentially life-threatening. If you know what's appropriate to go to or whether you have a day to wait, then the ERs will not be so crowded and you can actually schedule an appointment and be seen right away. So to summarize, there are many factors at play here. These are just some things that I've noticed while working in the ER for the past 5 years. But let me know some of your stories. What's the longest time you've had to wait to be seen in the ER, and what would you like to get changed? Thanks for watching. I know this was a short one, but I look forward to giving you guys more content soon. Take care.